Many of us need help navigating the healthcare system from time to time. Whether it's a need for mental health care, managing chronic pain, or simply getting an appointment, patients oftentimes fall through the cracks. At Select Health, we're helping patients with a proactive, holistic approach to treating the overall person. For members, care starts as soon as they enroll in a plan with us. We use a sophisticated suite of analytics to help identify members that might need some additional support. We identify those with chronic conditions and those who might have barriers to care.
Just had a member that had been identified as kind of potentially needing risk through reports that we get. So I reached out to a member. After talking, I realized she was homeless and talked about the community case manager program. And even though she didn't have a place to live, as long as they're able to meet with her in a public place, they were able to meet with her, help her fill out housing applications. She was struggling getting to her appointments and got her hooked up with transportation services and just able to really kind of make sure that she was able to get the care that she needed. She was just like, thank God for this. And she was just very appreciative. It really kind of turned her life around.
Sometimes patients can't afford to worry about health care until their basic needs have been addressed. When patients need mental health care, we help them get it. Mental and physical needs often go hand in hand, and eliminating the barrier of mental health concerns means that patients get to the right care at the right time so they can feel better.
I've been a nurse for 12 years, primarily in behavioral health, and I work on the Medicaid restricted team at Select Health. Restriction is a program for overutilizers of services. They're placed on the program if they meet certain criteria for non-emergent ER visits, getting abuse potential medications from unaffiliated providers, or seeing too many providers. Our success rate for members that engage with a care manager on restriction show that we decrease medical costs by 25%. And when engaged with a care manager, ER visits are decreased by 69%.
Many providers and clinics don't have the resources to help these patients, and we can bridge those gaps. We can help members coordinate care. This means that we'll help patients stick to the treatment plan that's been recommended by their doctor, or maybe they need help understanding how to take medications as prescribed. We're here to help patients with chronic conditions like diabetes, asthma, heart disease, and even cancer. Health insurance shouldn't be a barrier to care, and we can walk patients through their benefits, help create an action plan, and get them the support they need to improve their health.
I am a nurse case manager here at Select Health for the Medicaid population. I do the authorizations for the bariatric population. We do offer the bariatric/weight loss surgery here at Select Health. I have helped a patient who had a barrier due to his low income status. I was able to contact the office and discuss the situation, and they were able to give him this manual that was required as a pro bono. When I called the patient to let him know, he was ecstatic. He couldn't thank me enough. He was just really ecstatic. He was very happy for our services.
I had an opportunity to work with a member because I do the out-of-network stuff. She had enrolled in our Medicaid plan, and then about a month later ended up going across the country to visit her fiance. A truck barreled through their living room and tragically killed her fiance, and she was dragged several hundred feet, had severe burns and broken bones and just extreme trauma. I was able to contact her and her trauma team over there. She ended up being inpatient for a few months and was able to help her transition ultimately back to Utah to be with her family. She feels like I helped save her life. She's doing great, and she really appreciates the help that we're able to give her and continue to give her.
I have over 20 years of experience from anywhere from the emergency room to the OR to recovery. We talk to many members. Sometimes our members just want to talk to us. They just need somebody to talk to. So we just listen. If something comes up, we try and assist them with it. And then when we call them back, we'll just kind of see, hey, how are you doing? Is there anything else we can do for you? There's a lot of members that really appreciate that. But we get to build a rapport with them, and they get used to us talking to them and they feel comfortable telling us things.
Care management is ongoing for us as long as the patient is a Select Health member. We know that doctors can't be everywhere at once, and we are here to work with patients who may need a little extra help. Select Health care managers are nurses and social workers who are skilled at helping patients and providers achieve patient-centered care. We even have community health workers who can connect with difficult-to-reach members and help them get connected to the right resources. There's no additional cost for this service. It's just part of being a member of Select Health. To refer a patient or learn more about how care managers can make a difference, please call us.